Yes. And we are live.
Okay. Well, hello everyone. Thank you so much for attending this webinar. I'm Michelle. I'm a medical student at the University of Montreal in the cold Canada, but I'm right now doing an internship at the Pan American Health Organization headquarters in Washington, D.C., in the Emergency Operations Center. So today it is my great pleasure to present to you a webinar on mental health in emergencies, which is the topic I have been working on here during my internship. So we will have a couple of guests here with us talking to you about that wonderful and passionate topic. So without waiting anymore, we're going to start. So our agenda, we're going to talk a little bit about PAHO and the Emergency Operations Center here, then a little bit about my project as an intern, then why should we focus on mental health in emergencies, what we can do to address mental health in the context of disasters, how can you learn more about that topic, and if you have any questions, please note them during the presentation, and we're going to have a time for you to answer those questions afterwards. So we're going to start. I'm going to present to you my friend Noemi Polo, who is working here as Operation Information Officer at the Emergency Operations Center, who will present to you PAHO and the EOC.
All right, good afternoon, everyone. As Michelle said, my name's Noemi. I'm the information officer here in the EOC, so I'm kind of in charge of making sure we gather all information, producing some data analysis and updating our situation room, essentially. So I'm just going to give you guys a quick introduction about PAHO and our work in emergencies. So PAHO has over 42 years of supporting country capacity building for disaster management in the health sector. We have an office in, I think, every country of the region of the Americas, and on the map on the right, you can kind of see where our sub-regional offices are, and then us at the headquarter level or regional level, we are kind of in charge of them. So our role in emergencies is to essentially increase health sector resilience to emergencies and disasters and improve the effectiveness of disaster response. And we do this by, strengthening the health sector's capacity in prevention, risk reduction, preparedness, surveillance response, and early recovery. And we focus this on a multi-hazard approach. And then an important thing to keep in mind is that we tend to take action when national capacities are overwhelmed. And we lead and coordinate international health response to contain disasters and outbreaks and provide effective relief. So within the health emergencies department, we have the emergency operations centers, and the country's offices are supported by the EOC to manage information, coordinate operation response, and mobilize resources. The EOC is responsible for coordinating the organization's overall response and ensure that it's timely and effective. When we do begin a response, there is essentially a package, quote unquote, of emergency services, which include coordination, support, immediate response mobilization, and evaluation of damage, needs assessments, coordination of humanitarian assistance, epidemiological surveillance, environmental health. And under one of those health priority services is also the mental health component, which is what we are going to be discussing today. This is just kind of a quick overview of what we've responded to in 2018. Like I said, we focused on a multi-hazard approach. So as you can see here, we have things from social crises to natural hazards, outbreaks. So we kind of deal with it all, essentially. And then lastly, just to give a quick overview so Michelle here is part of our internship program, and we as an organization kind of recognize the importance of having, a new generation of public health leaders. I actually was an intern here at PAHO May of 2017. And so it's not kind of a straight line of how you can get into public health. Like I was actually in a different department or in a different unit focusing more on infectious hazard management. And then I came into the Emergency Operations Center and got more kind of operational response. But it is key that the organization does value, new, fresh minds. And I hope this was a pleasant experience for Michelle when she was here.
It definitely was.
And I think that's all from my part. Yeah.
Okay. So let me quickly explain to you what I did here for the past 2 months. So as part of my work at the EOC, the EOC is currently developing an application for the field workers that are going to help patients on the field during disasters in the Americas to have quick guidelines, for example, regarding communicable diseases, the management of certain types of diseases, the management of water and sanitation. So we decided to add the management of mental health. So how can, in a concrete way and in a very simple way, the field workers can address mental health issues in consequence of a disaster, because we know that there are lots of consequences on the mental health of a population during a disaster, but it is often overlooked, and that's what we're going to talk about in a few minutes. So my goal was to simplify the information, to collect all of them, much complicated information there is out there, and to make it simple, to make it in an app for the health workers to have some tips regarding mental health. So without waiting any longer, let's go into the core of our webinar. So why should we address mental health in emergencies? So we have with us here the wonderful Dr. Claudina Cayetano, who's the Mental Health Regional Advisor here at PAHO, and really kindly accepted to talk to us today. So Dr. Cayetano, the floor is yours.
Thank you, Michelle. Not necessarily the wonderful, but maybe the passionate. I wanted to say
that's definitely
because
true.
I'm very passionate about the about mental health, and of course, I jumped immediately to this opportunity to be part of this webinar, and not only to be part of the webinar, but to also be able to have the opportunity to work with the team and PAHO, because I think the role of mental health definitely, we have normally we say there is no health without mental health. So I think it's very important that mental health is included whenever we're talking about issues, especially when it comes to disaster. As a physician, I always like to start by thinking of definitions. Why do we have to define a disaster? I think because, we tend to, when you're as a medical student, you will be working in most times hospitals or health centers. So you do have an emergency department, but you don't have a disaster department. And the reason you don't have a disaster department, because we're talking of situations that tend to overwhelm the capacity of the community. But an emergency, you have emergencies every day. So you will be trained in terms of how to respond to emergencies. But you don't necessarily get training in terms of how to respond to disaster. So I think Michelle I was excited with the project, and that PAHO opened the doors for you to come and do your internships. Hopefully we get more medical students who are interested to do this, and that they also focus on the importance of mental health, precisely because of that. And as we all know, and as I was mentioning here, we have different types of adverse events, that some of them happens on a daily basis. So if it's an emergency, so then the local capacity is enough. But if it's a disaster, so this is when it's overwhelmed our local capacity. I hope they are still hearing us and they're there with us. So what is important for us? What is important for us is to have clear what are these actions that we need to do in order to be prepared to be able to respond to emergencies. So when we talk about prepared, that is what we're doing now. There's this set of actions, there's this set of capacity building to be able to minimize damage. So we need to have preparedness is achieved by implementing the response. So planning and training, and then increasing availability of resources. Most of the time, unfortunately, most times the resources are especially when it comes to mental health, we have very limited resources, limited human resources. So it's very important that we develop time to do work when it comes to preparedness, because we need to be able to have responsible people who can provide this kind of support when it's the emergencies. So response actions taken in advance event for the purpose of in terms of what is the role of PAHO. So this is what we're doing. PAHO response is achieved through mobilization of humanitarian assistance to cover these essential services when the population is affected. Now, it's also important because as medical students, your training is in pathology. I mean, you're trained to look at diseases. We don't get training to look at health, physical health. The training is always pathological. So I think because of that, it's important to also keep in mind that when something abnormal happens, there's reactions or feelings that are in line, like congruent with the disaster, with the emotion. So it's understandable that these reactions are not necessarily pathological. Yes, they are abnormal, but they're not necessarily pathological. So meaning that we don't want to be diagnosing people. So because you don't want to be diagnosing people and labeling them, once you diagnose someone, you want to give them medication, you want to provide, and this is not what we want to happen during a disaster. We want to be able to understand that each person responds differently depending on their culture, depending on how they react, different factors. So if we keep that in mind, then we are less wanted to make this is the kind of information we want to provide to you. So don't think only of psychopathology. So you don't need to have a psychiatrist to be there, or, you don't need that. So we want to be able to expand the field of mental health workers. We want mental health problems that should be assisted by. So there is people who are not necessarily specialized in mental health that can provide support, that can provide response. So the time for the psychosocial action is different depending on the victims, depending on the culture. But again, here, the message is that we don't want you to be thinking pathology. This is just, in terms of understanding that depending on the hazard, because it's different, we also have sometimes time when we can prepare, but there's times when you can't do a preparation. If it's an earthquake, you can't do much preparation. But if there is a hurricane, chances are that, yeah, we could probably do more preparation. And this is why it's important to do preparedness. Then we also have to be thinking of vulnerability. And this is important to just keep in mind, what do we mean when we talk about vulnerability? Because that also, it's important when we're doing the mental health and support work. Mitigations. We tend to think when it's mitigation, we tend to look at structure, a structural reinforcement, set of actions aimed at reducing damage that results of interaction of hazard and vulnerability. So these are terms that you will tend to hear when you talk about response disaster management. So vulnerable population is priority in the mental health work. And when we say vulnerable population, we're talking about, children and adolescents, the elderly, and according to their previous physical or physical or psychological disorders due to their living condition, due to their job. So people with disabilities. This is what we want to be able to keep in mind, that not each person responds the same. So this is important. And of course, our interventions, because we talk about psychosocial interventions, but they also have to be time sensitive. So in an acute phase, we tend to look at more psychological interventions, and then we also tend to look at post-disaster phase becomes more social interventions. So we use the term, sometimes we use terms interchangeably, but I think it's important to keep in mind that also depending on what interventions we are going to be focusing on. So the good thing for mental health, and this is one of the things why I'm passionate about mental health, is that there's a lot of stigma and discriminations, but I find that when it comes to disasters are opportunity for us to be able to develop or strengthen our mental health system. And that's the moment when people say, oh, what about their mental health issues, and I think this is a fantastic opportunity for us to be able to look into what's happening. And why mention strengthening the system, the mental health system? It may not be applicable to every country that we work with, but for PAHO, we work with, as it was presented before, a lot of our countries in the Latin Americans, they're mainly, when they mention mental health, they think of a psychiatric institution. And what we want is to strengthen the mental health system by providing more care in the community. So this is a fantastic opportunity to work in the community, to have, because a lot of people may not necessarily require intervention at a psychiatric level because it's not a pathology. So this is why that we need to make sure that we use the opportunity to improve the effectiveness of interventions, to think how do we then enhance our mental health system, especially at the community level. What recommendations then we want to be able to do when it comes to when you go to a country, when you're working with a community, you want to understand if they have a mental health policy, if they have a mental health plan. We want to make sure that this is an opportunity for us to, increase their investment in mental health. We want to make sure that we also have a clear understanding that sometimes think that emergencies, yes, it's possible that people have what we call a pre-existing mental disorders, and then a disaster can exacerbate the response. So someone who suffers from alcoholism or alcoholic disorders, or someone who suffers from depression, someone who suffers from schizophrenia, if they don't take the medication, then when there is a disaster, they can have a different reaction by someone who don't have any mental health problem. So I think it's important to keep that in mind. And then we want to make sure whatever recommendations we are providing, that these recommendations are sustainable, which means that, and this is why I think for mental health, when you have a disaster, sometimes you get these specialists coming, psychologists, psychiatrists, to provide services that may not be necessary for the country. And then when the disaster is gone, it's over, the specialists are not there. So that's not sustainable. So we don't want that to happen. We want people to be able to utilize their own resources. We want to train people at a local level to know what to do and how to do it, because that is more sustainable. That's their home, that's where they stay. So this is very important to keep in mind. Promote the inclusion of mental health services. Definitely is very important in response to disasters. That's why I guess I'm here too, because it's to promote the importance of mental health in terms of not just necessarily structurally, but in terms of services. We want to facilitate community services for people because, as I said, they don't necessarily, this is not a disorder, it's not pathology. So clearly we need to also emphasize the importance of training and develop the importance of building skills for people who are working in the community. We want to ensure that the primary healthcare providers and public health officers have some kind of skills in mental health, so that when there is a disaster, they don't have to feel overwhelmed, and then they know that they can provide a response. So they don't have to be thinking of specialized services. So these are the recommendations that we want to go for. So I just want to take you through quickly. I'm not going to go through this publication that was done in collaboration with our colleagues from PHE. It's a mental health and psychosocial support in disaster situations in the Caribbean. And this was very, very relevant to do this publication because we find ourselves every year, at least in the Caribbean tends to have, because of the geographic location, they're prone to hurricanes. So June to November is the high seasons of hurricanes. So PAHO needs to be, so we have offices in the Caribbean countries. So we needed to make sure that we work with these countries in helping them and prepare for this type of disasters. That gives us again, it's a window of opportunity to be able to intervene. So I'm not going to go over that. I think just to mention that it exists and it have different, that's a good publication. It's available in our websites, so you feel free to go through that one. And it also mentions some of the other publications from PAHO that are important to keep in mind, like psychological first aid. There's different ones that are relevant when it comes to response to disaster. I want to end my presentation by terminology because I think this is very important. Sometimes the way how we use our words, the way how we communicate, it also helps either to create more stigma or to cause more alarm when it's not necessary. So, for example, when we said trauma, and trauma is a word that it is for pathology, for people who may require psychotherapy. So it's not recommended when you're talking about mental health issue. People are under distress. People are anguished. They are tormented. They have psychological or social problems. Those are terms that are much more recommended. When you say trauma, that is totally different. So it's a traumatic, adverse events, terrifying events, life-threatening, but not traumatic events. So important to keep that in mind because we don't want to give that message that these are traumatized people. And that is really, that's not what we want. We want people to know that we all can go through distress in our life, and severely distressed people have these kind of reactions. So we have people who have reactions to a difficult situation, to a severe reaction. So when we think of symptoms, of signs, so then we think in pathology. So this is actually the importance to also talk about structured activities, but we're not talking about therapy, because if you say therapy or psychotherapy, these are clinical terms, and then people need to be trained and they need to have this license to be able to provide therapy. So important to keep that in mind. And I think for medical students, this is I think it's a good message that we want to send. So that's with that I end my presentation. Well, before that, one more. Communication, giving clear and accurate information. That's very important in mental health, because what happens if we don't give clear and accurate information, it increases people's level of anxiety. People have, then they have more issues with this anxiety, with sleeping, and so you don't want them to happen. So it's important to remember. One of the things that tends to happen before, there was this issue about psychological debriefing. This is ineffective. We do debriefing, technical debriefing. So EOS, like here, the emergency department will do technical debriefing. That's fine, but not psychological debriefing. That's ineffective, doesn't work. So it is not recommended. So from PAHO perspective, what we recommend is something very simple, which is the psychological first aid. There you will see it on the slide that we have to provide very basic PFA. PFA means psychological first aid. So, this is what is recommendable, but not to do. Bringing people together to do the briefing is totally ineffective. So in case of where emergency is induced, acute distress limits basic functioning. So you don't want to be doing that. It's intolerable. Clinical treatment will be probably needed. So these are just special recommendations that I wanted us to finish our presentation. So this picture that you see here is the picture of our organization in DC, and where we are working for the right of health in the Americas. So thanks for the opportunity to participate.
Thank you so much, Dr. Cayetano. I hope that you guys can hear the passion in her voice, because she is really passionate about mental health, and it's such a joy to work with her. So thank you for being here. So let me continue a little bit with you guys about, now we heard like why it's important to deal with mental health and emergencies, but then what can we do? So we're going to talk about 3 different levels: the non-specialized care, as Dr. Cayetano put a lot of emphasis on. How can we all can help? As medical students, we are perfect candidates to do non-specialized mental health or psychosocial support. The second one is the medical management, and then the public health management of mental health and emergencies. So the non-specialized care is the psychological first aid that she was talking about a little earlier. So if you're thinking about, let's say, an earthquake, the first people that will arrive on the site of the earthquake are not mental health professionals, that's for sure. They will be local people, survivors that are arriving on the field and that are trying their best to help. So we need to train untrained people to be able to help the psychological situation. Then what is included in the psychological first aid? The 3 steps: the psychological support, the social support, which are really interconnected but still needs to be considered individually, and then communications to the population especially. So this picture is the cover of the Manual Psychological First Aid Guide for Field Workers. I invite you guys to type that on Google. You will find it and you have access to all the content of it. So I think it's a great tool. It says as a definition, a human supportive response to a fellow human being who is suffering and who may need support in the context of a crisis. And it is meant for anyone in position to help others who have experienced an extremely distressing event. So as you see, medical students like fill all those requirements so we can do the difference. So like, how can we bring psychological first aid? It's all about empathy. So if you find someone on the field who seems to be in distress, which is a normal reaction, as we heard Dr. Cayetano say, but we can bring like comfort to that person. So by finding a safe and quiet place, by listening without pressuring the person to talk, by keeping the confidentiality of that person, staying calm, having a calm voice, a calm environment, by not leaving them alone if they really feel distressed, and by keeping them safe and meet their basic needs. So that's something very important. People will tell you, how can I concentrate on mental health while people don't have access to water, don't have access to food, and are not in security? So see, mental health tends always to go last because we say we need to provide first, like the basic needs. So that is true, but by giving basic needs to the population and by still applying those psychological first aid like tips that I just talked about, you are addressing mental health right away. Then let's continue. We also talked a bit about more vulnerable populations. So here we will talk about children and adolescents, about people with underlying physical or mental disorders, and about the volunteers themselves. So first, if you have children and adolescents, what's important is to involve a trustworthy child protection agency. We cannot say that we can deal with the children that have lost their family or lost their close one. We need to involve an organization that we trust. Then we need as much as possible to connect the children with loved ones and keep the families together as a priority. Because as we can see here, children cope better when they are with a stable and calm adult. So related to that, we also need to support the caregivers. So give support to the children, but also give the support to the people in charge of the children. Because sometimes the adults that are themselves going through a very distressing period, but that also need to take care of children, can be very difficult. Then another very important thing related to the social context is to try to keep the children in school and keep them doing normal activities as much as possible. Then if you have people with pre-existing mental or physical disorders, it seems pretty obvious, but you need to assure that they can have access to their medications and medical or psychological services. Because even if we're in an acute situation, there are some chronic disorders that we still need to address. Then you need to refer them to the hospital if they're not able to take care of themselves or if they may hurt themselves or others. Then you need to refer someone in the healthcare centers, not if someone is distressed, because it's normal to be distressed. The people don't need to go to the hospital because they feel very distressed. But if there's a significant risk of hurting themselves or others, as we all saw in medical school, we need to go to the emergency. If they're unable to take care of themselves or their children, it's the same. If they're in psychosis, for example, and that leads to the 2 first points, that's the same. And then after 2 weeks, if we suspect more chronic mental health problems like depression or post-traumatic stress disorder, then we can refer also to the hospital. So about the volunteers and staff, that is something that we talked about with Dr. Cayetano that is very important to remember. We need to take care of the people that give care. See, we need people in a good mental health state in order to be able to help others. They have many risk factors. For example, working long hours, having no resources, being confronted with horror, danger, human misery, and living their own personal reaction. So because of that, we need to ensure they have access to the basic psychological support as the rest of the population via psychological first aid. And if ever that distress limits the basic functioning, then they need to stop working and go to the hospital and ask for help. So that was the more psychological part of the psychological first aid. Now for the social part. As we said, we need to keep families together and bring affected people together so that they can support each other. We need to give access to religious support to the community. Facilitate the creation of community-based self-help support groups. So give responsibilities to the population to help each other. That will better help them to cope with the situation. Then ensure basic needs, as we said, stay in contact with the rescue team, stay in contact with the sanitation, the food team in order to help with those basic needs. Then consult the community regarding decisions. So where to localize religious places, schools, water supply, either in camps or in the community if those facilities have been destroyed. Then include recreational and cultural spaces and involve adults in the construction or organization of the society as we discussed earlier. Then regarding communications, first of all, we need to inform the population on how they can better cope with the situation and how they can themselves take care of their well-being and their mental health. So we need to tell the population, don't isolate yourself, talk and spend time with family, with friends, with the community, discuss your problems with someone you trust, do activities that help you relax, do physical activities, get enough rest, eat regularly, and avoid alcohol, drugs, caffeine, and nicotine. So that's something that we can say when we go on the field, when we go talk with people, we can give them those advice, but we can also try to go on the radio, to go on TV shows, or to reach a broader population and give them those advice. We also need to keep informed on disaster response and rescues. So, you know, the communication needs to be very good within the different teams, within the teams of rescues and the teams of mental health. So, because when you're going to help someone, you need to provide factual information if you have it. If you don't have it, you need to be honest about what you know and don't know. And then if you don't know, you need to refer the people to the organization in charge of rescue, because that's going to be a big part of the distress of the population, especially after earthquakes, which cause a big number of deaths in a short amount of time. So another very important thing is to inform on available services. So where can people find the food, water, and sanitation to have less stress? Then like which healthcare centers are still functioning? Where can they go? Where can they find those health services? And how can they go into those healthcare centers? Then what are the psychological and social support services that are currently in place? And where are the different camps? So it's a lot to keep in mind, but that is all included in the psychological first aid guide, which I really invite you to consult. So if we're talking now more in the medical management, so what is happening at the hospital? The first thing that we need to keep in mind is that when you're in an emergency, you receive many people that are close to dying. You need to do triage, and you're under pressure. You're not going to remember to tackle mental health. And that is normal. But still, we need someone to go to those healthcare centers and say, like, keep in mind the mental health component of that disaster, because if we tackle the mental health part, everything will go better afterwards. The recovery will go better, and general state of the population will be better. So that's my first point: integrate mental health care for survivors in general health care services. Then integrate psychological considerations into all sectors of humanitarian assistance. We're going to talk about that a little bit into public health management. And then provide health workers with training on mental health and psychosocial support. So maybe that's where medical students should come. Maybe medical students that don't have the training to save those lives in the emergency room can be the ones who provide just the basic psychological first aid, who come and listen to the patients and try to just to listen to them and to address their distress. So here is a slide that's pretty interesting that I found in the manual of, I forgot the name, but the recap after the earthquake in Haiti. So there was a section, a small section, but still there was a section on mental health. And they were saying that the percentage of people with a severe mental disorder increases by 1% above the estimated baseline of 2 or 3%. So Dr. Cayetano told us about that. But see, the problem is not the severe mental disorder, so we don't need more psychiatrists to deal with that. We need the basic care. So in addition, the percentage of people with mild or moderate mental disorders, including, for example, mood and anxiety disorders, may increase by 5 to 10% above the estimated baseline of 10%. So see, when we're going a little more mild, we tend to see an increase. But however, as the third point says, in most situations, there is natural recovery over time. Natural recovery over time will occur for many, but not all survivors with mild and moderate disorders. So we might see an increase at first, and that's where we need to tackle it fast in order for it to decrease rapidly and not needing more and more resources. I hope I'm getting my ideas clear here. So now to finish, the public health management. So that is something maybe a little above our role as medical students if there's a disaster. But it's something very important. What do the decision makers or the people that are coordinating all the response need to think about? First of all, coordination is the most important thing. We talked about it. The rescuers need to be aware of everything that's happening. The people providing the psychological first aid, just helping the people with their distress, need to be informed of what's happening with the food, with the water, with the rescues, with the security, etc. We need to bring mental health in every aspect of the management of a disaster. We need to address it, and in order to achieve the mental health management, we are obliged to go in every department, if I can say. Also, the community, the country can ask PAHO for the mental health roster if they need it. So what that means is actually a list of specialists that are associated with PAHO that can be deployed on the field if they need so. For example, the third point is assessment. If the country is having a hard time to assess their needs regarding psychological and social support, they can ask for PAHO. PAHO can evaluate which person is the best to go and provide help to the country, deploy that person there, and then help the government to build their assessment strategies. So the point is not for PAHO to send people doing all the job. Is to helping to coordinate and helping to train the people on the field to make it themselves. So the assessment, which was my third point, is something also very important. Then we need to have staff and volunteers that understand the culture. So that's something very interesting I read in that recap from the earthquake in Haiti. They were saying that, I will have it in a slide a bit further, but over 100 organizations went to Haiti just for mental health and social support. But in that range of organizations, some of them were over-medicalizing the situation, and some of them were untrained people that didn't know the culture. So it is very tough for someone that's not in the context to arrive on the field to try to help, but without knowing the culture, the social situation. So we at least need to have a training for those helpers, for those volunteers to understand the culture. Then the training of aid and health workers in mental health and psychosocial support, as we discussed. Even if you're a surgeon, you need to have like a few minutes of training to remind yourself on how you can better help your patients coping with the situation. And then assure well-being among staff and volunteers. That's a public health thing. Does it involve having more workers, finding more health workers someplace in order to make shorter rotations? Does it imply to create a team of like mental health helpers for the helpers or for the health professionals? Maybe that's the thing. So that's why it needs to be tackled at a public health level. So here we are to the lessons learned from Heidi. We already talked about it. So it's 110 different organizations that were there. So it's all a question of balance. I think what I wrote, what I read from that book is that in the end, the mental health management in Haiti got improved by that earthquake. However, it needed to go through a lot of difficult times with a lot of different people trying to do their work. So I think what we need to remember is that we all need to do it with a respect to the culture, and it all needs to come from the country. The country needs to ask for help, and then we need to find the best people to help them, not just to arrive and provide help as we can. So, okay, so here are the resources for you that like I used to create that PowerPoint and also to create my own project. So the first is Psychological First Aid, a guide for field workers, which is very good. It's a little more concise. So I think that if you want to read it or share it during an event, it's something very simple that medical students can learn a lot from. Then the second one, the IASC guidelines on mental health and psychosocial support in emergency settings, is a little more complex. It's the big guide that gives all the recommendations that you should know. And a lot of the time, the other documents are taking their inspiration from this one. And then the third one is mental health and psychosocial support in humanitarian emergencies. What should humanitarian health actors know? Oh yeah, I think I confused the first one with this one, but the first one was the psychological first aid that we talked about, like just tips on how you can help the population. And then this third one is a little like summary of the recommendations. So Dr. Cayetano talked about the mental health and psychosocial support in disaster situations in the Caribbean, which is another very good one. I invite you to type mental health in emergencies, just that, or mental health in emergencies PAHO, or mental health in emergencies WHO. That's what I did, and I found a lot of things. So if you want to organize an event or anything, I think you're going to find everything you need there. So before, let me just do a little wrap up. As medical students, we have the responsibility to be aware of what we can do in the context of disasters. I sent a little survey at the beginning of my internship to know if medical students had classes about disaster response, and most of them told me that they didn't. So I think we need to be more aware, and we need to be the one who push the mental health topic in the world of disaster management. So we're the one who need to remind our universities. We need to talk about mental health, who need to talk to their governments. Hey, we need to talk about mental health. Does our government have a plan for the management of mental health in disasters, or things like that? And if a disaster occurs, like it occurred in Haiti, like it occurred in Mexico, like it occurs every year in the Caribbean and in many countries of our continent, medical students like have the responsibility to go on the field and to help the best of their capacity. And I think that mental health wise, we are a big asset to the government. So that's what I wanted to remind you, and I hope that's what you're going to take out of this webinar. So before going to the period of question, I would like to give the I would like to give the mic to Dr. Leonardo Hernandez, which is the director of the Emergency Operations Center here in Washington, that wanted to like express you some words.
Okay, thank you very much for your work. This is important topic for us, and I have only one or two comments. The first is we need to attend the coordination. Probably we don't need psychiatric or medical doctors, but we need to be coordinated and coordinate the response in mental health and in other aspects of the response for the emergency. Is the most important. 110 organizations develop different plans, different actions in different moments, and with different language. It's very difficult to the people can receive the real support, and we can make damage in this personnel. You don't don't can provide help if you don't have enough organization. It's the first principle for us, and our mission is support the countries, support the health services on the field to make the action plan for mental health or for psychosocial attention in emergencies. If you don't have any plan, do you need made a plan and reinforce the capacity in the field, in the places, and reinforce the authorities on the field, and use the information available in from our web, the Red Cross, and the other organizations very strong in this material, in these topics. It's very important for us. Do you know these aspects? Thank you very much for your intervention, for your work here. It's very important for us. Mental health no is only one part of the health services. It's important part of the health. It's the people need food, the people need medication, the people need other elements for the life, but the people need mental health. The communication plan is other important aspect. The communication plan, the people need to know what occur around the situation, what is the future, what is the plan, what is the health network, what is the support network. The people need to know about what is the government plans, and are involved in the resolution of the concerns. The people need work. The people need to build the future and rebuild the future. And it's very important how we can coordinate this puzzle for the people. For me, is the most important, and in my experience in the field, when you involve the communities in the response, do you have a successful in the interventions. The voluntarism The volunteerism is other aspect. A lot of volunteers, physicians, psychiatrists, psychologists, and other personnel trained, but alone, don't coordinate it. Yes, it's very complicated, and we can manage. The best route for work in and provide my service to help others is under one organization, under any big NGO, under any church or whatever, but any trained personnel. And you can comment this, but in our experience, the weekends, the personnel who work only in the weekend is a distraction for the real work, and first don't make harm.
Mhm.
It's okay. Thank you.
Thank you very much, Dr. Hernandez. Did you have anything to add on that?
No, I like the last part about it because I think it reminds me of the Hippocratic Oath, do not do any harm. And I think given that in humanitarian acts, that's should also be the same. I just thought you made a fantastic point. That's for sure.
Okay. So I think that concludes our webinar. I think Katya Cheech, the scope director, wanted to give a few words and maybe then give the floor to some questions.
Thank you, Michelle. I also wanted to thank our wonderful externals. This was an amazing webinar that really taught us all a lot. So I would really like to thank you. And also a big thanks goes to the regional assistant from Americas, Michelle, because she organized this whole thing. So a big thanks to you too as well. And now I will leave the floor to the questions.
So I think that for the questions, they need to send it by like via the conversation. Katya, can you guide me on that?
I can just read it through the YouTube.
Okay.
So far, we have one question from Jamsa, Jamaica, and they're asking if this medical student role is analogous to the role of the community health worker in mental health with respect to similar training skill sets.
Can you repeat the question, please?
So they're asking, is this medical student role analogous to the role of the community health worker in mental health with respect to similar training skill sets?
So if the medical students should provide like the same help as health workers regarding mental health?
Yes.
No, they are talking about the non-specialized community health workers. People from the community that has.
If it's analogous, if it's the same, yeah. I think it was said before that what we want is to make sure that the coordination is key. So people who are working in for providing humanitarian services, they should be part of an organization that is providing that service. Therefore, we need to make sure that the skills that they have the right skills to provide the right services. So if we have a medical student, so if we have a community health worker, let's say they have the skills to provide psychological first aid, they have the skills. So it doesn't have to be. So to me, what is important here is two issues: that we do not want to send people to the field that are not prepared. And that they're going on their own just because they want to help. This is not what we want. We'll create more damage than help. So it's not whether if they're medical students or they're not medical students. Yes, we understand that being medical students, you have basics, you have the science, you have the knowledge, but we're talking about disaster response, we're talking about disaster management response. And what we want is to be coordinated and to be effective in how we provide that service. So I wanted to insist on that not because they are medical students, that then mean that they are equally right to be going to provide the service. I think we need to make sure that they are under the umbrella of organization and that it's well coordinated. Otherwise, we'll also be creating more chaos.
So do you think that the medical students should reach an organization, should reach their university, should reach a hospital? If they want to go help, who should they go reach?
So I think here, if there's a country, if there's an organization, if the country has a plan, if there's many organizations, but they also have to be very reputable. It cannot be any kind of organizations, because again, we need to be very, very careful. These are also opportunities for people to get into situations where they can do fundraising and cause a lot of chaos. So they need to be careful in terms of who they're partnering with. And again, here I think, or Dr. Hernandez can make the point in terms of coordination, but coordination with whom? Who is this organization? Is this an international reputable organization? Otherwise, they put themselves into trouble, I think.
Dr. Hernandez, anything to add?
No. We need the skills. We need the umbrella and the big structured organization and trained organization is a lot. Unfortunately, any organizations don't make good work in the past. And the results are very bad. I saw in the past in a lot of emergencies, political groups delivered attention, mental health, the weekends, and they don't have any skill for this. It's crazy, and I prefer to identify the good organizations and you try to work with them.
So that was a very good question. Thank you so much for that.
Exactly.
So making sure that before going on the field, even if you know you have the capacity of going, making sure that you are under either an organization or a bigger system. So I now have the questions, Katia, with me. There's a few more questions. Let me read the first one. So from Rodrigo Sanchez Iturregui. Thank you very much for your interventions. We really appreciate them as students. I was wondering if PAHO is involved at the local level for coordinating organizations aiming at managing disasters. I say this as there was this series of floodings and mudslides in the Peruvian northern coast because of the Niño phenomenon last year, and organizations were kind of overlapping their actions. Anyone?
Yes, all people like to coordinate, but any like to be coordinated. And we have this problem. Our role is try to coordinate the cluster of health. Is the group of organizations who works in emergencies, in health emergencies. And it's very complicated. Our role is try to support the country, the Ministry of Health in the country, to make one plan, the joint plan of action. In Peru, in this case, we deploy a lot of people during 3 or 4 months to assist the Ministry of Health in the local level and work in water and sanitation, water quality, and in epidemiology surveillance, and in other aspects of this emergency. But no, it's easy. It's very complicated. No, it's sexy work. The people don't like this. It's invisible work in any occasions. All organizations, different persons like to put the flag and no more. Find the visibility, and the other aspects are secondary, unfortunately.
Yeah. And just for your question about PAHO working at the local level, so PAHO is like the regional division of the World Health Organization, and also have offices at the national level. So for example, in Panama, in Colombia, in the countries. But then for the local level, it's more of an assistance to provide to the local level rather than really taking action at the local level.
Yeah.
Am I right?
We have 26 country offices in the Americas, and we try to coverage all Americas, 36 countries and territories, 36, 37 countries and territories, and we work through these country offices to help the Ministry of Health in any country. Is our role.
So we have two more questions from Suriname. Can you give me some tips on advocacy for my government? Recently, we had an incident on a river and 12 people died. We provided psychological first aid, and the importance of mental health is subdued again.
Oh, well, I'm so glad that you asked that, and I'm really glad to know that you provided psychological first aid, which means that you are trained in that, which means that you know what to do, hopefully in a manner that is about, listening and helping people to find the right resources. In terms of, as it was said by Dr. Hernandez, we have an office. Actually, we have an office in Suriname. PAHO has an office there. We work very closely with the Ministry of Health. So it's the Ministry of Health that then will get together with the office in PAHO to see how best they can provide the necessary support. From our regional office, we actually also are available whenever there is the need, that if they require any assistance. And I think Michelle was very clear in mentioning that we do have a mental health roster. So if the country do require an assistance, they will have to go through PAHO to do that. And the reason why we prepare the the reason why we put together the roster is because we want to make sure that we have people who understand how we provide technical cooperations and how to do the work in a manner that, we are, in a manner of we consider effective, and that they are trained and they're using the most relevant information. So we sorry to hear about the problems that you recently encountered, and don't just provide. I think it's good that you're asking the question, but just ask the government. They can actually, in Suriname, the office for PAHO is right near to the Ministry of Health. So I think it's fantastic that it's the Ministry of Health that will seek that support, and definitely I know that the PWR there will respond to that request.
Complementary to that question, I would like to say that there is a way of working at all levels, as either as health worker or as an interested party, even as a student, and which is start writing, documenting things, and maybe sharing this documentation with the decision makers or stakeholders, and probably they would have more access to certain levels that would allow the interaction with PAHO and to get or with the Ministry of Health. Therefore, it's always better, rather than just sharing ideas or historical memories. I think it's better if you have something in written, documented, that would help decision makers in order to move forward in whatever the decision would be made.
Mm-hmm. Thank you for that. So we're going to answer the last question here a little quickly. So PAHO's ECAT course. So from the SSTM. not sure who's that, but emergency care and treatment in disasters teaches medical first responder care, but not much is included for mental health. Should first responder training include mental health?
To answer that one, there's no health without mental health. So yes. I think we want to make sure that precisely from what we've been saying, we want to keep that in mind. And I think you said it in your presentation too. What about mental health? So we would want that to be included. So it's the first aid, it's psychological first aid. So yes. Thank you.
Yeah, so thank you for your question. If ever any of you that are listening are involved in first aid or in training of first responders, I think that's a very good way to advocate for better consideration of mental health in emergencies by training the first rescuers to help. So I think we're going to conclude on that. I thank you very much for attending. Thank you for everyone here at the Emergency Operations Center who were present and who helped me in that webinar. So I hope that you learned a lot. And if ever you have any question, you can write to me. So I'm the SCOF Regional Assistant for the Americas. So ra.scof.americas@ifmsa.org. I can answer your questions. If you need some resources, I can also send them to you. I will also make the PowerPoint available on the IFMSA's Facebook page. Oh, there was a last question that was quite interesting. So I think I'm gonna go with it very quickly. That person wanted to ask about the language barrier in psychological first aid in case of refugees or things like that. Would you have any tips to address the language barrier?
Yeah, because we want to make sure that people, it's not just the language barrier, it's actually cultural issues. Remember, we talk about cultural barriers, language, that people who are providing support, psychosocial support in disaster management, they take that into consideration because they will start to make assumptions or misinterpret, and communication is key. Communication is key. Mm-hmm. So language barrier is something to consider, the culture of the person. So don't go without understanding that. Again, this is why coordination is important. So before people are going into these situations, they need to know if they understand the culture, if they understand the language, if what more or less the situation is happening. And those are the things that happen if the organization is an organization that has done a good job. They will take into consideration all these things. Just don't jump into the situation without doing our due diligence.
So sometimes involving translators is something
that necessary then in that case, but you need to do your due diligence before getting into these kind of situations. Yes.
Yeah. Okay.
Do you be part of the solution or part of the problem?
Mm-hmm. Yeah.
Yes.
So that's a very good question, and I think it's something we definitely need to keep in mind. So I think we'll need to end on this, but thank you so much for everyone for being here. Thanks to PAHO for the opportunity. Thanks to IFMSA also for giving us the platform for this presentation. And so write to me if ever you need anything. So have a good day or a good night or a good morning, regardless of where you are in the world. Bye-bye.
Bye.
Good. Great. Fantastic.
Right. Thank you very much.
First time we're doing this.
Great.
First time we're doing this.
Yes.
I think
we're still
presentations.
I think
yes.
it's still
Still
working.
yeah.
Regularly.
I know you do a lot.